It's the little things that citizens do that will make a difference. My little thing is working with young people. Hi, my name is Diana Kemunto, a medical doctor and a public health specialist by training. I currently work at USAID Kenya and East Africa as a project management specialist for adolescent HIV. My leadership project is on improving pre-exposure prophylaxis uptake among adolescent girls and young women. So, why adolescent girls and young women? When we look at the HIV epidemic data, we note that adolescent girls and young women aged 15 to 24 years old remain disproportionately affected by the burden of the disease. In 2023, out of the 210,000 new HIV infections reported among adolescent girls and young women, 77% of them were living in sub-Saharan Africa. Compared to their male age counterparts, adolescent girls and young women are twice as likely to be living with HIV. This therefore means that the HIV prevention discussion is critical as the world races towards ending the HIV/AIDS epidemic by 2030. Oral PrEP has been shown to be highly effective as an additional prevention choice, but PrEP, like any other medication, works only when taken. So adherence is critical in its effectiveness, and suboptimal adherence is what we note among adolescent girls and young women. There's also low demand for PrEP in this population. Misinformation about PrEP and myths surrounding it still exist. In our current setup, PrEP delivery, including information provision, is still largely a healthcare worker function. We know that peer influence is a pervasive force in adolescence and that peers are able to influence behavior. Peers are able to utilize appropriate language to communicate sensitive topics, provide social support, and hence able to drive up demand. With this background in mind, therefore, my leadership project aims to leverage on existing peer mechanisms within the HIV care and treatment space and working with the peers themselves with an overall goal to improve uptake of pre-exposure prophylaxis for HIV prevention among adolescent girls and young women. The implementation takes a stepwise approach with key activities in implementing the project highlighted here, and they include collaborative efforts with colleagues at national, agency, implementing partner, facility, and community level. So, what have been some of the notable achievements so far? One, development of the National Peer Education Guidelines for adolescents and young people, which clearly stipulates the critical role that adolescent peers play in HIV prevention messaging, including messaging on PrEP. Internally, we've worked with colleagues to develop a simplified PrEP training curriculum for AYP peers, which was customized from the existing PrEP training curriculum. We've reviewed our baseline data and identified implementing partners for the pilot. The next steps are as highlighted here, which will include the national launch of the peer education guidelines. This is subject to availability of resources from stakeholders to support the same, and resource mobilization is currently ongoing. Sensitization of the peers, and they will be used to conduct the dissemination of HIV prevention messaging to their fellows, peers at facility and at community settings. Monitor the outcomes, document the findings, disseminate the learnings from the pilot, and scale up the intervention. As I come to the end of my presentation, allow me to reflect on my leadership journey this past year. It has been a journey of resilience and growth, both at a technical and personal level, which I'm eternally grateful for. Implementation of my project has allowed me to work in a space that I truly enjoy being in. It has also allowed me to step out of my comfort zone, moving out of the HIV treatment space into the HIV prevention space, where I've had to collaborate with colleagues, including colleagues at the Ministry of Health, to meet key milestones. This has helped to improve my relationship building and networking skills. Through mentorship and coaching sessions, I was able to receive invaluable feedback from colleagues that allowed me to tweak my project halfway and change the implementation approach from top down to bottom up. To sustain the momentum, I've also inspired colleagues among the implementing partners to view the AYP peers as critical assets in the program and to continue to empower and build their capacity in other areas beyond HIV prevention. This will continue even as the country looks forward to the rollout of newer HIV interventions. Thank you for your time and thanks for listening to me.